I always tell it's going to work, it's not going to work. I always say that because root canals, that root canal treatment works.
And
but
obviously, you are a specialist, so to you it's not hard. But is it painful? Because a lot of our patients are so scared of a root canal.
it's like another dental treatment. We numb the area.
You asked for a specialist because you guys specialize in that field.
Yes, we specialize, and I only do root canals. It's only I do because I have many patients that touch, and they're I feel sore. Why? But you're touching the tooth. We work inside the roots.
Hello, welcome back to Supreme Dental Podcast Studio. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Listen, you can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast is meant for you, our patients. And today we have Dr. Michelle. How you doing, Dr. Michelle?
Hi, good. Thank you.
She's very nervous with this. She's our root canal specialist. If you've been to Supreme, most likely she's the one that's helped you out. And today we're going to talk a little bit about root canals. We're going to talk about, we have several questions from our patients that let us know different concerns and questions that they have. One of the main ones is always about root canals. Is a root canal needed? What is it not needed? Does it hurt? A lot of questions. And I want to go ahead and solve that for our patients. So the number one thing that we get is, does every crown, when we need 5, let's say we need 10 crowns, do you need root canals in every teeth when you do a crown?
Hi, everybody. For that question, no. It's not always if you have a crown, used to have a root canal. First, we need to take x-rays and look how is your tooth and how it's if you have pain before. And then we decide if you need it or not. But it's not always need a root canal if you need a crown.
Let's say that I need a root canal.
Okay.
Let's say that I come in and when I drink something cold or something that has a lot of sugar, it hurts.
Yes.
What's the next step? What do you do?
Yeah, we do some tests here with cold, and some tests, cold test they call. They take an x-ray and we look why you are feeling that. If it's a old filling, metal filling, it's too big and it's close to the nerve, you need a root canal. But if it's not, maybe just put a new crown or change the filling, it's gonna work. But we need to do first a test and x-ray.
Test and x-ray. So let's say that you already done an x-ray.
Okay.
And my cavity is very close to the root.
Okay.
And what's the next step? What do you do?
Okay. Well, when it's sure that you need a root canal because it's too close to the nerve, and that root canal treatment, it's clean the nerve and put some medication inside.
It's not something that's hard to do.
It's a treatment that it's not never hard to do because we numb the area and we clean the nerve.
Okay, so it's well, perhaps to you it's not something that's hard.
Yes.
I wouldn't be able to do it.
Okay.
But when you have everything ready, and obviously you are a specialist, so to you it's not hard. But is it painful? Because a lot of our patients are so scared of a root canal.
It's like another dental treatment. We numb the area. It's like when you do extraction. It's the same. We numb the area and we clean the tooth. It's not painful anymore. Maybe a couple years ago, maybe yes, because it's not. They use another techniques, but in this time, it's not painful.
That's very, very important because we get a lot of patients when they come in. They say, I've had a root canal in the past and it hurt so much and they took so long. They took like 3-4 hours on one tooth. It hurt so much. My cheek, I look like a chipmunk.
Yes.
And they're so scared of doing a root canal, so they rather just pull the tooth.
Yes.
And when they come here, we're like, no, we we could still save your tooth, because the number
Yes.
one purpose is to save the tooth
Mhm.
if it can be saved. And so what do you, when someone is in your chair, let's say I'm your patient, and I'm just like, I've had a bad experience before, Dr. Michelle. They took a long time to do it. You look young, so automatically you look young, so they're thinking, oh, she just got out of school, she doesn't have, and the other guy who did it was like in his 60s, and it still hurts so much. What do you tell me as a patient when I'm in the dental chair, so I could just understand and relax that times have changed?
I always explain my patients first where it's the root canal. Then I tell that trust on me, because I am the specialist and I am doing the treatment. But many patients are nervous and have bad experience, because in other places it's not the specialists that do the root canals, it's always the general dentist. That's why it's that bad experience.
So that's something to really look into, guys. If you go to get a root canal anywhere else, any clinic, anywhere, you can go in Canada, United States, Mexico, Colombia, anywhere. Make sure that the person that's doing the root canal is actually a specialist. Because if I'm not
Yes.
mistaken, the dentists, when they go to dental school, they learn how to do root canals.
Yeah, we're not like, I guess, a general like others classes, but it's not a specialty. It's not a specialty.
And you, do you do crowns?
No, I don't do crowns.
You specialize.
I only do root canals.
So
yes.
it's better to go somewhere where they, no matter what happens, they're going to know how to deal with it, because they specialize in
Yes.
the form of that's getting done, the dental work that's getting done. That's very, very important. That's why people get those bad treatments. That's what patients get, that he didn't know what he was doing. It hurts a lot. It got inflamed. I had the worst experience. I felt everything. It's because they're not going to a specialist.
Yes.
You guys have to ask the clinic, are they a dental specialist? Are they an root canal specialist? And if they go, oh, well, it's part of being a dentist, then you ask for a specialist, because you guys specialize in that field.
Yes. We specialize, and I only do root canals. It's only I do.
And I've heard that the assistants, and this is coming from assistants, okay? Our assistants rotate.
Yes.
And I've heard that the most boring thing to assist is root canals.
Yes, I know.
That it is, but the root canal specialists have like a chip, and I feel like for you to be a root canal specialist, you gotta really love, because they get excited. Like, oh, look at this root canal, came out so perfect, and it looks. I mean, I don't see a difference, but you guys get very excited.
Yes, yes.
And I see doctors that do, for example, dentists that do aesthetics, or that do implants, but they're doing implants, they're doing all on fours, they're doing, sinus lifts, they're doing everything, and you guys are doing root canals.
Only root canals. Yes.
But I mean, there's so many different types. You guys have 1 root, 2 root, 3 roots, and you guys have to make sure you guys don't fracture the tooth and everything's clean, or you can have a big problem. Obviously, what you guys do is very important, but I heard it's very boring, and for somebody that to do it, they gotta really like it.
Yeah, it's boring, but I love it, and it's like very specific. I only see the tooth. The assistant don't see nothing. I am seeing with the mirror, with the dental mirror. It's like very little. The canals are very little. We need to be very, very delicate with that.
Welcome to Dental Facts. Did you know it's vital to keep your toothbrush dry because bacteria grows faster on wet surfaces? You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
So I see that you have different machines. What are all those machines that you have?
Well, one it's the file motor. They call that we use rotatory files to clean inside. It's new. They have like different shapes for different anatomies of the tooths. We have an Apex ID. We call it that just to length the root, and it's technology. It's to make easiest the work for us and for the patient. We use it, yes.
You probably get a lot more precise.
Yeah, it's very, very precise. And then we take x-rays, of course, to be sure. Because one thing it's the technology saying, but in the x-ray, if the x-ray is like on point of the root, we are done.
Okay, perfect.
That's why we take x-rays. It's very important.
Very important. So tell me about patients that don't believe in root canals, because we get that all the time. Also, patients that say root canals don't work. I had a root canal a year ago and they had to extract the tooth. Once again, was it a specialist that did it? We don't know. And then there was this series on Netflix that got taken off because they proved that it was wrong.
Yeah, the latex like toxic.
Yeah, what was that all about? Because I remember they said that.
I think I heard, but that it's a company of implants that made that. It's like a kind of.
I like it. It's kind of like they did it to beat the competition.
Yeah, like it's the competition because implants it's the best in that Netflix series that's saying that implant it's better than your natural tooth.
So they're telling you the root canals don't work.
No, don't work.
Let's pull your tooth and let's put an implant.
Yeah, and it's money. Oh, it's for money, obviously.
That's why Netflix took it out.
Yeah.
I think, wasn't it the Root Canal Association or the Endodontics Association?
Yeah, the American Endodontics Association do that. They take it out. That's why.
They made sure they take it out.
Yeah.
It was a lot of false information.
Yes, because it's better to keep your natural tooth. It's the last option is the implant. Yes.
And this is also important, guys. If your finger, if 3 of my fingers hurt, I don't chop off my arm, chop off my hand and give me a metal hand, unless it's the last thing that could be done. Then obviously give me the metal hand. But if I could save it, there's nothing like having your own natural teeth. What made you choose to be a root canal? Because you became a general dentist, correct?
Yes.
Well, you could have done implants. You could have done periodontics. Why root canals?
When I was in dental school, it was very difficult to me to do root canals. I hate root canals when I was in dental school.
Really?
But when I came out and see how it works, the technologies, and it's fast then years ago, I think why not be a root canal specialist?
So you hated to do root canals.
I hated in dental school.
And then you decided to do root canals.
Yeah, because I see how is it in the real life, not in school.
Oh.
You relieve pain. You help people to keep your tooth in your mouth. That's why I decided to be a root canal specialist.
Because sometimes it goes to your hand, and the doctors, it goes to your hand, and you are like, either you save the tooth, or they either got to do a bridge, or they either got to do an implant and wait 6 months. So it's in your hands. And a lot of times patients do come in and say, I haven't been able to eat. I haven't been able to sleep. It hurts so much, and you relieve them from pain. I think it's the only dental procedure besides pulling the tooth that relieves a patient from pain.
Yes.
So that's why you decide to do it.
Yes, I always, I'm very honest with my patients. I always tell, it's going to work, it's not going to work. I always say that because root canals, the root canal treatment works, but we need to see the circumstance of the patients. How is the tooth, the tissue inside, all of that. We need to evaluate. Not all the patients are candidate to have a root canal.
So what happens when, let's say I got 4 root canals
Okay.
now, okay? And now I'm going home, or I'm gonna get some crowns. What do you suggest me to do? What are some steps for people to have a successful root canal? What do you suggest?
Okay, I prescribe some anti-inflammatories and painkiller just in case, because every patient is different. I have patients that tell me the day before, I don't feel anything, or I don't feel pain, I don't feel sore. That's great. But many patients, yes, I prescribe just in case to take a painkiller and anti-inflammatory if it's not infection. If you have infection, we need to take antibiotics for sure Then don't touch the tooth. No touch, no move. Because I have many patients that touch and they're,
Keep on
I feel
poking.
sore, I feel sore. Why?
Yeah.
But you're touching the tooth. We work inside the root. Obviously, you're gonna feel sore. Your tissues was cleaned inside. The roots we clean. We put a medication. That's why you feel sore. And just don't touch. Take the medication, and that's it. Maybe don't eat hard food like some, I don't know how to say.
Hard candy. Or
Yeah, like just like a few days, 3-4 days.
What about things that are too hot or too spicy?
No, it's okay. Just maybe the gums are gonna feel like sore, but it's not like problem with that.
And every root canal is different, right? Like if
Yes.
somebody comes with a lot of infection,
Mm-hmm.
then it's a completely different thing.
Yes, we have several infection. I prefer to do into appointments.
2 steps of
The steps, yes, because we need clean, leave medication 7 days, and then we seal it. But many patients came very, very far away. That's why we treatment in one appointment. But we prescribe some antibiotics. We tell that maybe you feel a little pain, a little sore, but it's normal because you have an infection. And they work. Root canals works. Believe that.
And that's what we tell our patients. If they didn't work, then we wouldn't do them.
Yeah. Mhm.
If a root canal did not work, or if it did worse to the patient, we would not do them.
Yes.
So, that's awesome. Tell me about, is there an experience in particular that you remember from a patient that, a lot of times you have many patients a week.
Yes.
And in a busy week, you do many root canals.
Yes.
And obviously that helps you to see different circumstances, different
Yes.
scenarios, and you just keep on getting better, better, and better. But is there a patient, a lot of people think like, oh, well, she's just a root canal specialist. I'll get it done. She doesn't even care. I'm just another number.
Yes.
But we're human. So is there someone in particular that you remember that you were just, that got up, gave you a hug, or what do you remember?
I remember one. It was very young. I think he was like 25, 26. He go to another dental clinic here. They told that Allen 4 treatment, and then he came with us, and I'm like, no, why root canal? They go, why Allen 4? We can do root canal. We can save your tooth. You have 25 years. Maybe in the 40s, maybe you can think in Allen 4, but not in this time. And he don't believe us, and we explain. He came with his mom. I remember that. And we explained to his mom that what is the procedure. And we did it, and we changed it. Wow, there was a big change for him. I think they have the pictures over there. But we do I think we do in the upper, we do like 6 or 7 root canals because he needed.
Yeah.
In the bottom, I think like 5 or 6 because it was like big cavities, and we saved many of your tooths.
Well, we'll make sure to get that picture up.
Yes.
And so we can show a picture of that.
Yes.
We normally get a lot in the United States. When you turn on the TV and you see a dental commercial, they don't talk about root canals.
No.
They don't talk about crowns. They talk about implants. They
Yes.
talk about I come in, I come out. Some guy's driving a truck. Then he leaves and he's smiling. Pulling all your teeth and getting implants, it's an option, but it's the last option.
Yes.
It's the last. It's not like, well, I've had some problems in the past. Take my teeth out. Give me new teeth. And I'm done. No, you're not
No.
done, because you still got to maintenance those. They're not going to be like what you've had before. I
It's
don't.
a big change.
And it's like a mindset that they put in
Yes.
TV. Like they tell you, well, you can come in, come out, and you're done, and you're finished, and everything's beautiful.
And you're never gonna be
You're
more
never gonna-
for the
Yeah, you're never gonna go to the dentist
Yes,
again, and that's
yes.
not true. So
No.
I don't know. A lot of times when patients come in and they say, pull all my teeth out, and we tell them, well, you don't need to do an all-on-4, and their estimate is, I don't know, let's say $20,000, and to do an all-on-4, take extractions out, do bone grafts, do immediate loads, do the final procedure, and to do the other way, which is saving their teeth and getting root canals done, it's like $11,000 or $12,000.
Yeah.
So it's a lot cheaper. You come down, you're done, and you have your natural smile. And we have so many pictures. Hopefully we can find that picture that you said.
Yes.
But we have so many pictures of so many patients that we've had, and they're normally young patients that said, actually, we just had someone, the Murphys just came in, and his wife Heather Murphy was saying that that her husband just wanted to get an all-on-4, and that she was scared, like, what? And he's like, yeah, you know what, I'm done, I want to pull them all out. And he came here, and we were able to save his teeth.
Yes, I remember him. I do one root canal only
On him. And you did,
Yes.
did you do some on Heather also?
Yeah, like 4.
And we were able to save his teeth, and I don't know if you've seen the last podcast, but he's saying, like, I haven't smiled in 10 or 12 years, and now I did a selfie with my wife, and his voice started breaking because he wanted to cry, and I wanted to cry because I was like, oh, he was right
Yes.
here. So it's have an open mind when you come down. When you come down, wherever you decide to go, obviously you're trusting that doctor, you're trusting that clinic.
Yes.
So trust that they're gonna do the best thing, but also make sure that they show you what they're doing. So when we show our patients, well, you see these roots, they're super long. I'm gonna hurt you more than help you when I pull that tooth
You're gonna
out.
lose bone. It's more traumatic. It's
It's
a
a
lot
longer
of
process, and maybe the bone graft that we put there, maybe with so much bone you're gonna lose, maybe we won't be able to do the implants right away. And we show our patients, and a lot of them say, wow, man, I came here ready to spend this much, and I spend this much, but I'm done. And that's when they're not just patients, they become fans. They're part of the family, because now they're like, you could have made so much more money, but you did what was right.
yes.
And that's the things that we gotta do, is we gotta do what's right. Actually, George, if you want to step in here, George, his wife is she's a root canal specialist, and right now when she was talking about root canals, he was celebrating because he's a diehard root canal fan.
Yes.
But and it's not always the easiest thing to do, and a lot of patients that they've heard this so many times, when we tell them, oh, we can save them, they're like,
No.
what? And then we have to show
Yes.
them, look at this case, look at this case, look at these teeth, and they're like, oh my god, those teeth were horrible, but look at these teeth now. They're like, oh my gosh, see, your teeth are not as bad. We don't care what your teeth look on the bottom, we care what your teeth look on the upper portion. It's very, very, very exciting to do. Now, tell me about when you are doing a root canal and someone's very nervous. What do you do to calm them down? Because one thing is, put your trust on me, but now that you started, there's some patients that shake
Yes.
or that are scared. What do you do?
I think they are scared for the numbness part and to feel pain, obviously. But if I numb very, very good, they really stay calm. Or maybe they fall asleep. Most of the times they fall asleep. I used to be very careful with that, with the numbness part. Always. I can wait 5 minutes, 10 minutes just to get the numbness work, and the patient start to trust me and start like, oh, okay, that's great. And I left, you can use your cell phone, just, I don't know, being on an Instagram, Facebook,
Yeah.
just to get distracted, and then they work. When I left 5 minutes, the numbness is working, and I start. I never start if they're feeling pain or they're feeling sensitive, because it's very
Uncomfortable.
Exactly.
I pass by when you're getting root canals, and some of the patients fall asleep.
Yes.
And I could say that right now on camera, and people are gonna be like, "Yeah, right." But patients that been here, they actually Heather talked about how she felt bad because she fell asleep.
Yes, they are closing. Heather, open please. And she was she was asleep.
She said she was completely
See?
asleep.
Yes.
That's awesome. That's awesome. And I've said this in so many podcasts. There's doctors that are made doctors, and there are doctors that are born doctors. And my wife and I feel that you were born a root canal specialist because you get so excited when a root canal, and I don't think nobody else in the clinic does, but you do. And obviously you change many people's lives. You and the dentist work together to make sure to give that patient the best solution possible, not the most expensive one.
No,
because the most expensive would be pull everything and get an all-on-4, all-on-6 or whatever. It's you guys work at doing what's best for the patient.
Yes, we work as a team always. When a new patient came here, the doctors call me and say, Doctor, let's take a look here. And we decide. We are a team because we want the better treatment to our patients and to be successful. That's why we are a team here.
That's awesome. That's
Yes.
awesome. Well, thank you so much. I want to give a shout out to my little girl, Alondra Navarro, who made this amazing bracelet. This is one of a kind, guys. Don't try to buy it in stores because they don't sell them. She made it for me. So I want to thank George. George for being. We just had a sandstorm right now, guys, and the electricity went out. So, we have some sand all over our face.
Yes.
Electricity's back up, so we decided to jump on. But thank you so much. I know you've been
Thank
doing some
you.
root canals this morning,
Yes.
and the electricity actually just went down a little bit. So thank you so much, and we'll see you soon here at Supremedental Podcast.
Thank
Have a
you.
good one.
Bye.